Code Blue, Trauma Bay 3. The announcement shattered the Houston Methodist ER. Dr. Kaden Voss didn't run. He never ran. Years of trauma surgery had taught him that panic kills patients. What happened next would expose systematic racism in American healthcare and change hospital policy forever. The incident. The victim arrived on a gurney bleeding from multiple traumatic injuries. Car accident on I-10. The paramedic reported breathlessly. Male. Blood pressure crashing, possible internal hemorrhaging. Dr. Voss's hands moved with practiced precision, assessing injuries while issuing rapid-fire orders to his surgical team. Get me a CT scan. Stat. Type and cross-match for units. Prep OR for emergency laparotomy. His team moved like a choreographed dance. Nurse Martinez started the IV line. Surgical resident Dr. Chen called for imaging. Anesthesiologist Dr. Patel calculated medication dosages. Have you ever been so good at your job that people still questioned your competence, doctor? Kaden Voss was about to experience it at the worst possible moment. That's when Valeria Mitchell walked into Trauma Bay 3. Hospital administrator, MBA from Wharton. Operational excellence, zero medical training, and a track record of questioning black physicians that nobody dared document until tonight. What's happening here? Mitchell's voice cut through the controlled chaos like nails on a chalkboard. Dr. Voss didn't look up from the patient. Multiple trauma preparing for emergency surgery. We have time before he bleeds out. Who authorized emergency surgery? I did. Voss's voice remained calm. I'm the attending trauma surgeon on duty. Mitchell's eyes narrowed as she took in his appearance. Dark skin, natural hair under the surgical cap, the expensive watch partially visible beneath his gloves that she assumed was fake. I need to see your credentials, she announced loudly enough for the entire ER to hear. The surgical team froze. Dr. Chen looked up from the imaging console, shock written across her face. In years of residency, she'd never heard an administrator demand credentials during active patient care. Nurse Martinez's hands stilled on the IV line. She'd worked with Dr. Voss and knew he was the most qualified trauma surgeon in Texas. She also knew what was really happening here. Ma'am, doctor, Voss said without breaking focus from the patient. We're in the middle of a life-threatening emergency. This conversation can happen after I save this man's life. This conversation happens now. Mitchell's voice carried the absolute authority of someone who'd never been told no. Hospital protocol requires administrative oversight for emergency procedures. I need confirmation that you're actually qualified to perform this surgery. Actually qualified? The words hung in the sterile air like poison. Dr. Patel, the anesthesiologist, stepped forward. Valeria, Dr. Voss is our chief of emergency medicine. He's performed over trauma surgeries with a survival rate. This patient is dying. We need to move now, but Mitchell had made her choice. She pulled out her phone and started recording. For the hospital record, she announced her phone camera, pointing at Dr. Voss. I am documenting concerns about unauthorized surgical procedures being performed by staff whose qualifications have not been properly verified. The patient's blood pressure alarm started beeping. Critical levels. Minutes, Dr. Voss said quietly, his eyes still on the monitors. That's how long this patient has before catastrophic organ failure. You can question my credentials later. Right now, I'm saving his life. I don't think you understand how this works, Mitchell replied, her voice dripping with condescension. I run this hospital. Nothing happens here without my approval. And I don't approve of cafeteria workers playing doctor. Cafeteria workers. The insult detonated in the trauma bay like a grenade. Dr. Chen's mouth fell open. Nurse Martinez's face flushed with anger. Even Dr. Patel, who prided himself on professional detachment, looked stunned. But Dr. Kaden Voss's expression didn't change. "OR is ready," he said calmly into his headset. "Let's move." What Valeria Mitchell didn't know, what she was about to learn in the most devastating way possible, was that some assumptions cost more than others. And this assumption was about to cost her everything. The surgery. The operating room's sterile environment provided no escape from Mitchell's presence. She stood in the observation gallery above OR, her phone still recording, her expression radiating contempt through the glass. Dr. Voss could see her making calls. Hospital board members, legal department, anyone who would listen to her concerns about the unqualified black doctor performing unauthorized surgery. His hands never wavered. "Scalpel," he requested. Nurse Martinez placed it in his palm with the precision born of years working together. The incision was perfect, textbook fun steel approach, modified for trauma access. His movements were economical, precise, almost meditative in their controlled urgency. Above them, Mitchell's voice carried through the intercom she'd commandeered. "I want his employment records pulled immediately. Check his medical school verification. This is exactly the kind of liability issue I've been warning the board about," Dr. Chen, assisting with retraction, whispered. "Dr. Voss, this is insane. Should we call someone?" "Focus on the patient," Voss replied, his voice steady as he navigated through damaged tissue. "That's all that matters right now." But Nurse Martinez was already documenting everything. Timestamps, direct quotes, witness accounts. She'd seen this pattern before. Black doctors facing scrutiny that white doctors never encountered. This time, though, she was creating a paper trail, minutes into surgery. Mitchell's phone conversation grew louder. "I don't care what his file says. I'm watching him right now and something feels wrong. Get me the surgical director. I want this stopped immediately." Dr. Voss identified the bleeding source. Ruptured spleen with arterial involvement. Complex but manageable. He'd performed this exact procedure times. "Clamp," he requested. The surgical field was being controlled. Suction. Blood cleared, revealing the damage. Forceps. The repair began. His hands moved with the muscle memory of thousands of hours in operating rooms. Harvard Medical School, Johns Hopkins residency, years of trauma surgery, over lives saved. But to Valeria Mitchell, he was just a black man in scrubs who didn't belong in her hospital. Above them, Mitchell's calls were getting results. The surgical director, Dr. Ronan Barnes, appeared in the observation gallery. He was an older white man, respected but cautious, who'd learned to navigate hospital politics by avoiding confrontation. "Valeria, what's the emergency?" Barnes asked, slightly out of breath from rushing over. "That," Mitchell pointed at Dr. Voss, "is your emergency? I want to know why we have unverified staff performing complex surgeries without administrative approval." Barnes looked through the observation window and his expression changed immediately. "Valeria, that's Dr. Kaden Voss. He's our chief of emergency medicine and one of the finest trauma surgeons in the country." "I don't care what title he claims," Mitchell snapped. "I care about proper protocols and procedures, and I care about the liability issues when unqualified staff." Unqualified. Barnes's voice rose for the first time anyone could remember. Kaden Voss graduated top of his class from Harvard Medical School. He completed his residency at Johns Hopkins Hospital. He's published peer-reviewed articles on trauma surgery techniques. He saved more lives in this hospital than any surgeon in our history. Mitchell's expression didn't soften. If anything, it hardened. "Then why doesn't he look like our other chief physicians?" she asked, her voice quiet but unmistakable in its meaning. The observation gallery fell silent. Dr. Barnes stared at her. horror dawning on his face as he realized what she'd just revealed about herself. And on camera, since she was still recording. Below in the OR, Dr. Voss's hands continued their careful work. Spleen repaired, bleeding controlled, patient stabilizing, blood pressure improving, doctor. Patel announced. Heart rate normalizing. He's going to make it. Dr. Voss allowed himself the smallest smile. Another life saved. But as he began closing the surgical site, his phone buzzed in his locker. Multiple messages arriving simultaneously from his assistant, his legal team, and someone listed simply as Dad Personal. What happened next would change everything. The revelation? The surgery took total. The patient was stable, transferred to ICU, expected to make a full recovery. Dr. Voss stripped off his gloves, scrubbed out, and finally checked his phone. Missed messages. The first was from his assistant, Dr. Voss. Hospital Administrator Valeria Mitchell has filed formal complaints, questioning your credentials. Legal department requesting immediate meeting. The second from his legal team. Boss, we're monitoring the situation. Mitchell has been making calls to board members. Should we intervene? The third from his father. Son, I just got a call from Ronan Barnes about some administrative issue at the hospital. Do I need to make some phone calls? Dr. Voss smiled slightly. His father, Dr. Barrett Voss Sr., didn't make phone calls. He made earthquakes. But Kaden had spent his entire career avoiding the use of his family name for professional advancement. He'd built his reputation on skill, dedication, and patient outcomes, not on his father's legacy as one of the most successful cardiovascular surgeons in American history, not on his father's millions in donations to Methodist hospital system, not on his position as founder and chairman of the Voss Family Foundation, which funded medical education for underrepresented minorities across states. Definitely not on the fact that the very building they were standing in, the Voss Emergency Medicine Center, bore his family name. But some moments required revelation. Dr. Voss walked into the hospital administrative conference room. Present were Valeria Mitchell, Dr. Ronan Barnes, Chief Medical Officer Dr. Nadia Chen, Legal Counsel Declan Martinez, and board members who'd been awakened for emergency consultation. Mitchell stood at the head of the table like a prosecutor presenting evidence. Thank you all for coming, she began. We have a serious credentialing issue that requires immediate board attention. Tonight, I observed a physician performing complex trauma surgery without proper administrative authorization. When I requested verification of his qualifications, he became defensive and hostile. Dr. Voss stood silently near the door, still in his surgical scrubs. Furthermore, Mitchell continued, pulling up her phone video. I have documented his unprofessional behavior and flagrant disregard for hospital protocol. This represents exactly the kind of liability. Valeria? Interrupted Doctor. Nadia Chen, the chief medical officer. Do you know who you're talking about? I'm talking about Dr. Voss, Mitchell replied dismissively, who claims to be qualified but refused to provide proper documentation when requested. Board member Layla Williams leaned forward. Valeria, did you verify Dr. Voss's credentials before filing these complaints? I verified that he violated protocol by... Did you check his personnel file? Williams pressed. Mitchell hesitated. I was addressing the immediate concern of... His file, Williams said, opening her laptop, shows that Dr. Kaden Voss holds an MD from Harvard Medical School with honors in surgical disciplines. Completed residency at Johns Hopkins Hospital, where he served as chief resident. Board certified in emergency medicine and trauma surgery. Published author of peer-reviewed articles. Recipient of the American College of Surgeons Distinguished Service Award. Current survival rate for trauma surgeries, which is higher than the national average. The room was silent, except for the hum of the fluorescent lights. Williams continued reading. He's also listed as Chief of Emergency Medicine, appointed with unanimous board approval, and he serves on hospital committees including our Medical Ethics Board. Mitchell's phone slipped from her nerveless fingers and clattered on the conference table. Board member Ronan Wilson pulled up a photograph on the large conference screen. It showed the hospital's main entrance with a bronze plaque clearly visible. Voss Emergency Medicine Center, dedicated in honor of the Voss family's commitment to excellence in emergency care. Dr. Voss? Wilson said, addressing Kaden directly for the first time. Perhaps you'd like to explain to Miss Mitchell why you didn't mention your family's connection to this hospital when she was questioning your qualifications. Dr. Voss spoke for the first time since entering the room. Because my qualifications have nothing to do with my family name, he said quietly. I earned my position through years of medical training and practice, through patients whose lives I've saved, through peer-reviewed research and clinical excellence. He paused, his eyes meeting Mitchell's. I didn't mention my family's donations because I've spent my entire career proving I belong in operating rooms based on my skills, not my last name. But Miss Mitchell's behavior tonight demonstrates exactly why my father established the Voss Medical Equity Foundation in the first place. The room waited. Systematic bias in healthcare, Voss continued, costs black patients billions annually in worse outcomes. Black physicians face discrimination more frequently than white colleagues. And administrators like Miss Mitchell perpetuate these disparities by assuming black doctors are less qualified, less competent, less deserving of authority. He pulled out his own phone and opened a document. I've been documenting discriminatory incidents at Methodist Hospital. Tonight's event is number. Each incident involves a black physician being questioned, undermined, or dismissed by administrative staff in ways that never happened to white physicians with identical or lesser qualifications. Mitchell tried to speak, but Dr. Voss wasn't finished. Miss Mitchell demanded my credentials during a life-threatening emergency. She called me a cafeteria worker playing doctor. She told Dr. Barnes, I don't look like other chief physicians. All of this is recorded by her own phone. Ironically, and witnessed by multiple staff members, he advanced toward the conference table. The patient I operated on tonight is alive because I ignored her interference and focused on medical care. But how many patients have died or suffered complications because qualified black physicians were undermined during critical moments? The question hung in the air like smoke. The transformation. Board member Layla Williams cleared her throat. Dr. Voss, what are you proposing? The Voss Medical Equity Protocol, Kaden replied, displaying a comprehensive document on the screen, named for my father's vision of healthcare that actually serves all patients equally. The protocol appeared on screen. Page after detailed page of policy changes, immediate implementations, mandatory bias training for all hospital staff, real-time discrimination reporting system with direct board oversight, administrative staff prohibited from interfering in active medical care without clinical justification, third-party audits of physician treatment by administrative personnel, zero-tolerance policy for race-based credentialing questions, long-term systematic changes, diverse physician recruitment initiative with annual budget, medical school scholarship fund for underrepresented minorities, mentorship programs pairing experienced physicians of color with residents, regular climate surveys measuring equity and inclusion, public reporting of diversity metrics, and bias incident rates. This protocol, Dr. Voss explained, will be implemented across all hospitals in the Methodist system. The Voss Family Foundation will provide initial funding of millions. Dr. Nadia Chen, the chief medical officer, leaned forward. Kaden, this is extraordinary, but implementation at this scale requires board approval, legal review, union negotiation. Already done, Dr. Voss interrupted gently. My legal team has been preparing this. Union representatives reviewed the proposal and supported unanimously. The only thing missing was documentation of an incident significant enough to justify immediate implementation. He looked at Valeria Mitchell. Miss Mitchell provided that documentation tonight. The board members looked at each other, then at Mitchell, then back at the protocol displayed on screen. Dr. Voss, said Ronan Wilson slowly, are you saying you orchestrated tonight's incident? I orchestrated being present for an emergency surgery in my own ER, Kaden replied. Miss Mitchell orchestrated her own discriminatory behavior. I simply documented it. Declan Martinez, the legal counsel, spoke carefully. Dr. Voss, Ms. Mitchell's behavior tonight constitutes potential violation of Title VII hospital anti-discrimination policies and possibly patient care interference. Given the video evidence and witness testimony, we have grounds for immediate termination. Mitchell's face went white. You can't. I have employment protections. I was following protocol. You were following bias. Dr. Voss interrupted, and yes, you have employment protections, which is why, instead of termination, I'm proposing mandatory equity training, public apology to affected staff, and reassignment to a role without physician oversight authority. Mitchell stared at him. You're not having me fired. Firing you accomplishes nothing, Dr. Voss replied. But having you participate in implementing the Voss protocol, having you publicly acknowledge your bias, having you become an advocate for change instead of an obstacle to it, that accomplishes everything. He turned back to the board. Punishment doesn't fix systems. Accountability combined with education and systematic reform fixes systems. Miss Mitchell will either become part of the solution or she'll remove herself, but the protocol gets implemented regardless. Layla Williams nodded slowly. The board will vote on emergency implementation of the Voss Medical Equity Protocol. All in favor? Hands raised simultaneously. Opposed? Silence. The protocol is approved for immediate implementation across the Methodist hospital system. The Voss Medical Equity Protocol had transformed Methodist hospital system completely. Discrimination incidents down across all hospitals. Diverse physician recruitment up. Patient satisfaction scores among minority communities increased percentage points. Staff climate surveys reported feeling the hospital was more equitable. National media coverage. Major outlets covered the protocol. Other hospital systems adopting similar policies and counting, Doctor. Kaden Voss stood in the newly established Medical Equity Training Center, watching Valeria Mitchell lead a workshop for incoming administrative staff. The assumption I made, Mitchell was telling the class, her voice steady but humble, was that a black physician couldn't possibly be as qualified as I expected based on his appearance. That assumption nearly cost a patient his life. It definitely cost me my credibility, and nearly cost me my career. She clicked to the next slide showing Dr. Voss's credentials. Dr. Voss had every right to have me fired. Instead, he offered me the chance to be part of fixing the system I'd helped break. That choice taught me more about leadership than my MBA ever did. The administrative trainees took notes, many looking uncomfortable as they confronted their own potential biases. After the session, Mitchell approached Dr. Voss. I never properly thanked you, she said quietly, for giving me a second chance. I didn't do it for you, Dr. Voss replied gently. I did it because systematic change requires more than punishment. It requires people willing to acknowledge their biases and work to overcome them. He gestured at the training center. You're helping train the next generation of hospital administrators to see physicians as physicians, regardless of race. That matters more than any revenge I could have taken. Mitchell nodded. The protocol has been adopted by other hospital systems. You've changed healthcare across the country. We've changed it, Dr. Voss corrected. Your willingness to publicly confront your own bias gave other people permission to do the same. That's how systematic transformation happens. Dr. Voss returned to his office in the emergency department, where a new plaque hung on the wall. Excellence requires no explanation, but equity requires constant vigilance. The Voss Medical Equity Protocol. His phone buzzed. A message from Dr. Chen, his former surgical resident. Dr. Voss, I just got my fellowship placement at Johns Hopkins because I saw you handle discrimination with grace instead of anger. I learned that systematic change beats individual revenge every time. Thank you for the example. Another message from Nurse Martinez. Boss, our new discrimination reporting system logged its training completion today. 0 incidents this month. The culture is actually changing. And finally, from his father, son, I built buildings. You built something better. You built equity. Proud of you. Mine to Dad. Dr. Voss smiled and turned back to his computer where patient charts awaited review. Because at the end of every systematic change, every protocol implementation, every transformational moment, the work remained the same. Save lives, document bias, create change, repeat.